The NHS does turn 70 today. The focus is as much on its future as on the history being marked on this anniversary. As events take place across the country to celebrate the big birthday, debate continues over funding and what the NHS will look like in the future. The NHS Confederation involves all the organisations that commission and provide NHS services. It's calling for a new plan for the National Health Service, which it says has to be completely patient-centred as it moves into its 8th decade. Niall Dickson is the NHS Confederation Chief Executive.
I think the health service is doing remarkably well, given the pressures that it's been under. If you think about it in funding terms, the last 9-10 years have been the most difficult in the history of the health service. It's the lowest levels of funding that it's been used to since it began in 1948. So the average up to 2009 was nearly 4% every year, year on year. Now, it didn't come every year. Sometimes it was a lot more than that, and sometimes it was a lot less. But overall, that period, it was around that. Since then, the health service has really had to cope with almost no real increase in funding over that whole period. There have been small increases each year, but really nothing substantial, and certainly nothing that could remotely meet the rising demand that it's facing. So I think it's done remarkably well, but waiting lists have gone up, and there are enormous pressures in our accident and emergency departments. There are difficulties getting patients out of hospital and into the community, and community services have been very significantly underfunded. So I think it's struggling, frankly, but is doing remarkably well in the circumstances.
So looking forward, you've come up with the NHS Confederation has a 10-point plan for the future of the NHS. What does that involve?
Well, what we're responding to is what we think should be in the government's plan. So the government has announced 3.4%. Says it's going to give the health service in England every year for the next 5 years. And the challenge is what is going to be in that plan. Now, our fear is that the government will just grab hold of some things that appear attractive to politicians and put those into the plan. Our hope is that they will genuinely consult with doctors, nurses and others working within the health service, and indeed with the wider public, and be honest with them and say, actually, this will involve some quite difficult choices. We may not be able to do all we want to do immediately. The rising demand is so considerable, and over the next 10 years is likely to be even greater than over the last 10 years. We're likely to see a doubling in the number of people who are over 85 over the next 10 to 15 years. That is a massive increase. And many of those older people have got a number of long-term conditions which need help and management. And so the health service will need the funding to do that, and also we will need to train and support the staff in order to be able to do that. So we're very keen that the government is realistic in the plan that it puts forward, that it listens to the health service, and that it sets priorities that we can all get behind, accepting the fact that we believe that it is not enough money to do everything that we want to do. Well, in that case, let's choose what we can do.
And looking into the future, where do you think the NHS will be in the next 10 or 20 years, let alone in the next 70?
Well, I think in the next 10, and you're right, I don't think I can remotely begin to predict the next 70, but over the next 10 to 15 years, I would say, first of all, that if we get sustained additional funding and some predictability about that funding, which would be really helpful, because really the history of the health service has been a series of jerks up and then pulls down, and that's hopeless for planning. So some predictability will be hugely advantageous. If we get a bit of that and we get some reasonably decent funding going in over that period, I think first of all we should manage to meet some of the extra demand that is going to come from this rising number of elderly people. Technology is going to change, and the nature of medicine will change in two ways. I think new drugs and treatments will arrive, often more personal for the particular type of condition that you have. But also, I think we will find that technology in the form of automation and digitalization will mean that we can use data much more effectively. We'll be able to identify what different groups of patients want, and we'll be able to target and provide a much smoother service, joining up the different bits of the system in ways that, frankly, in the past we've struggled.
Niall Dickson, Chief Executive of the NHS Confederation.